نحكي عن السكند بارت اوف respiratory disorders. راح نحكي عن diagnosis of asthma. Diagnosis depends على physical examination. Your doctor will start with a physical exam. They will look at your nose, throat, and upper airways. Use a stethoscope to listen for a whistling sound when you breathe. Check your skin for allergy symptoms like asthma or hives. They will also ask you about signs of asthma such as wheezing, coughing, breathing problems, chest tightness, medical history. راح يسأل بعض الأسئلة. What are your symptoms? When do you have them? What seems to trigger them? Do you have high fever? Does the family member have high fever or asthma or allergies? What other problems do you have? يعني الأسئلة هتكون عن الميديكال history. Lung function test to test how well your lungs work. Metal spirometry. This simple breathing test measures how much air you and how out and how fast. Peak flow. Peak flow test measure how well your lungs push out air. Exhaled nitric oxide test. Chest X-ray. While a chest X-ray is not an asthma test, your doctor can use it to make sure nothing else is causing your asthma symptoms. Asthma treatment. Rescue inhalers or quick relief inhalers. These are medications you breathe in. You use them to ease asthma symptoms when they happen. They relax the muscle that tighten around the airways. This helps to open them up so you can breathe easier. These medications include short-acting beta agonist, anticholinergics to reduce mucus in addition to open your airways, oral corticosteroid to lower swelling in your airways, combination quick relief medicines contain both an anticholinergic and a short-acting beta agonist. Preventive long-term medications. These medications work over the long term to treat symptoms and prevent asthma attack. They include inhaled corticosteroids, inhaled long-acting beta agonist to open your airways by relaxing the smooth muscles around them, combination inhaled medicines, Locatrine modifiers to relax the smooth muscles around your airways and easy swelling, Thiophyllin to relax the smooth muscles that narrow your airways, long-acting bronchodilators, oral corticosteroids. If no other medicine can get your asthma attacks under control, your doctor might have you take these medications for a couple of weeks. They come in pills or liquids. Asthma nebulizer. If you are having trouble using small inhaler, your doctor may prescribe an asthma nebulizer. Avoid asthma triggers. Common triggers include pet dander, dust, pollen and outdoor mold, tobacco smoke, cockroaches keep food and garbage in closed containers, cold air, cover your mouth and nose in cold weather, indoor mold, fix leaky pipes, and clean moldy surfaces with bleach. Quick relief asthma drugs. These medications provide fast relief of asthma attack symptoms like cough, chest tightness, and wheezing. They include short-acting beta-agonist, bronchodilators, anticholinergic. These are bronchodilators that can be paired with or used instead of short-acting beta-agonist. Systemic corticosteroids are anti-inflammatory drugs that get symptoms under control. ننتقل إلى respiratory disorder الآخر, pneumonia. Pneumonia, what is pneumonia? Pneumonia is a lung infection that can change from mild to so severe that you have to go to the hospital. It happens when an infection causes the air sacs in your lungs to fill with fluid or pus that can make it hard for you to breathe in enough oxygen to reach your bloodstream. Anyone can get this lung infection, but infants younger than age 2 and people over age 65 are at higher risk. That because their immune system might not be strong enough to fight. You can get pneumonia in one or both lungs. You can also have it and not know it. Doctors call this walking pneumonia. Causes of pneumonia include bacteria, viruses, fungi. If your pneumonia results from bacteria or a virus, you can spread it to someone else. Lifestyle habits like smoking cigarettes and drinking too much alcohol can also raise your chances of getting pneumonia. Symptoms of pneumonia depends on the cause of pneumonia, your age, and your overall health. Common pneumonia symptoms include chest pain when you breathe or cough, cough that produces phlegm or mucus, fatigue and loss of appetite, fever, sweating, and chills, nausea, vomiting, and diarrhea, shortness of breath. If you have a new cough, fever, or shortness of breath, call your doctor to ask about whether it could be COVID-19. Illness with the new coronavirus can also lead to pneumonia. Causes of pneumonia زي ما حكينا ممكن تكون bacteria, viruses, fungi can cause pneumonia. Common causes include flu viruses, cold viruses, bacteria called streptococcus, pneumococcus. Pneumonia diagnosis test includes blood test to look for signs of a bacterial infection, a chest x-ray to find the infection in your lungs and how far it's spread, pulse oximetry to measure the level of oxygen in your blood, a sputum test to check the fluid in your lungs for the cause of an infection. Other tests such as an arterial blood gas test to measure the oxygen in a small amount of blood, bronchoscopy to check your airways for blockage or other problems, a CT scan to get more detailed image of your lungs, a pleural fluor culture to look for bacteria that might cause pneumonia. Pneumonia complications include bacteremia, in which bacteria spread into your blood. This can cause septic shock and organ failure. Second, trouble breathing, which might mean you need to use a breathing machine. Third, fluid built up between the layers of tissue that line your lungs and chest cavity. Fourth, lung abscess, when a pocket of pus forms inside or around your lung. Pneumonia treatment. If you have bacterial pneumonia, you will get antibiotics. If you have viral pneumonia, antibiotics won't help. You will need to rest, drink a lot of fluids, and take medicines for your fever. Pneumonia symptoms: coughing, hacking, or wheezing, and you might think it's just a cold or the flu. Common pneumonia symptoms. Pneumonia symptoms can range from mild to severe, depending on what's causing the illness and how healthy you are in general. High fever, up to 105 Fahrenheit. Coughing, up greenish, yellow, or bloody mucus. Chills that make you shake. Feeling like you can't catch your breath. Feeling very tired. Loss of appetite. Sharp or stabbing chest pain. Sweating a lot. Fast breathing and heartbeat. Pneumonia symptoms in children. When kids have pneumonia, their symptoms might be harder to spot. They may have rapid breathing, trouble breathing, fever, cough, wheezing, skin, lips, or finger tips that look blue. Symptoms in babies might be vague, like fussiness or trouble feeding. Types of pneumonia: hospital-acquired pneumonia. You catch this type during a stay in hospital. Community-acquired pneumonia. Community-acquired pneumonia can be caused by bacteria, viruses, and fungi. You can catch pneumonia when someone who is infected coughs or sneezes. Bacteria-filled droplets get into the air where you can breathe them into your nose or mouth. Viral pneumonia. Viruses are the second most common cause of pneumonia. Many kinds cause the disease, include some of the same viruses that bring on colds and flu, and the coronavirus that causes COVID-19. The symptoms of viral pneumonia are similar to the flu, including fever, chills, dry cough, stuffy nose, muscle pain, headache, tiredness, weakness. Causes: viruses that can lead to pneumonia include influenza A and B, virus A and B, respiratory syncytial virus, coronavirus, including SARS, COVID-19, rhinoviruses. How viral pneumonia spreads. Viruses that cause pneumonia travel through the air in droplets of fluid after someone sneezes or coughs. These fluids can get into your body through your nose or mouth. You can also get viral pneumonia after touching a virus-covered doorknob or keyboard and then touching your mouth or nose. Diagnosis depends على طبعا على التشيب كومبلينت، على الفيزيكال اكزامينيشن، على بلاد تيست، على التشست اكس راي، بلاد كلتشر، كل هاي الاشياء. Treatment: if a virus is causing you pneumonia, antibiotics won't help. If you have an influenza virus, your doctor may prescribe medication such as Tamiflu or Relinasa, Rabivib, بكون هيك خلصنا المادة ويعطيكم العافية. وطبعا المادة الموجودة هاي هتكون هي فقط المادة المطلوب منكم، ادرسوها. إذا في أي سؤال أو استفسار تواصلوا معي، والأسئلة راح تكون فقط من هذه المادة اللي أعطيتكم إياها. بالتوفيق إن شاء الله. كل عام وأنتم بخير.